many people, and again, they've been to therapy, they're psychologized, they're quite well, but they are looking specifically for a space to make meaning. And you can't buy meaning. And I suppose there are certain people we can go for to access that. And I think even in my way of working, it always leads to helping people find that melancholic space, like that you depleted, you empty, you don't feel anything. But I suppose the reason why people come back, we are constantly trying to make that meaning. For
In
as
this
long as we still
episode of the Living Consciously podcast, I speak to registered clinical psychologist Anele Siswana, who is also the director of Indigo Wellness and Consulting Services. Anele uses African healing systems and holistic psychological modalities in order to help his clients find healing, meaning, and purpose. Anele is an academic and healer, one that heals at multiple levels, where he incorporates both African situated psychology and African practices. Do listen till the end to this unique conversation, which will help you find healing and meaning, specifically from an African perspective.
Perfect. Thank you again for making time today for this conversation. And I'm really looking forward to just talking to you. I think I've been doing a little bit of research on your work and what you do, because the first time I was exposed to you was on Life with Kelly. And and I was like, oh, this guy, he is so authentic, just you had such an authentic vibe. And even now talking before we started this podcast or recording, you just have a really authentic vibe and an authentic way to connect with people. And I think, I don't know, that's the energy that I'm getting from the work that you're doing, that you just want to be authentic, promote healing, as yourself and not as, somebody else. So for those of you listening to this podcast or watching this YouTube video, wherever you're listening to this, I'm speaking to Anele Siswana, who is a psychologist and also Mkhulu, and and also a lecturer, I see. So, Anele, thank you so much for being here. Tell me more a little bit about the work you do and how you got into these spaces.
Mm. I suppose for me, the work that I do started on my journey when I trained as a psychologist. I trained at Rhodes University between 2013 and 2014. And I worked in the Eastern Cape for until about 2015. Then I moved to Gauteng to do my year of community service at George Mukari Academic Hospital. So I did the basics of what I was expected to do as a clinical psychologist in training. So then I discovered something missing around the gap of African situated psychology, and how I will explain why I call it African situated psychology rather than calling it African psychology. So I was trained in a very Western European way of what we know what a psychologist is. And then I discovered that no, there's a gap here. So since then, I started engaging, maybe probably for my master's degree. I, on my methodology section, because I was doing a study on the psychology of the rite of passage, we call it ulwaluko, that is moving from boyhood to manhood. So it's a rite of passage that involves young boys being initiated, firstly circumcised, and then initiated into Xhosa manhood and masculinity. So my thing was, I can't ask an African situated question about an African reality and use the dominant framework of what we think of when we talk of research or when we do research. So since then, I started reading a work about what is decolonization, the decolonization of psychology, how we think about a psychology that is not entirely white or Eurocentric driven, because I'm wary of the fact that I'm in South Africa and that my realities need to be situated within South Africa. So since then, I did my dissertation, and well enough, it went well. And then I started writing a lot now about indigenous practices, but my focus on my publication was on Xhosa initiation. So I did find my findings, the psychological impact of what that process does. But in any case, I couldn't get to the gist of it because it was centered around still, you write your dissertation in English. There was no place for language to keep. You have to, even though you write your extracts from your participants, they still need to be translated into English. Whereas ideally, I would have wanted to keep it closer. But because of that, I then started developing a great interest as to other phenomenons that are African, as to how do we make sense of the psychology located in African rites of passage psychologically. Then time went, and then I started working in private practice. And for some reason, I've always worked in privileged spaces or privileged areas like Bryanston, Sandton, all of these prestigious places. And there I realized that a lot of people that come to see me, they have what I call African situated problems, where it's not your nice life problems that, yeah, one may be privileged to have worked hard enough to secure what they have. But ideally, I realize that there's a need of situating myself as a psychologist that is an appreciation of these realities that are presented to me. So it
So,
became more evident, just in closing, more evident when I started having my calling in 2017.
okay.
I ended up in hospital, in a psychiatric hospital. You can imagine how that was like for a psychologist to end up in a psychiatric hospital at Kiso. Stayed there for about 2 weeks, and they did all sorts of medical tests that you could imagine, and they found nothing. In fact, they found epilepsy, which is I discovered later the kind of epilepsy it was. When I'm in a trance, my brain seizures are active because there's something happening that I was not aware of. Fast forward time, 2018, I accepted my calling. 2020, I started on the journey. And this is then now where it seemed like psychology found me in a different space. And since then, I allowed the spirit, I allowed my ancestors to do the work. And I'm just a vessel of God's work, of my ancestors' wishes and aspirations, and I just took myself to be embodied in those experiences of that which is of God and that is of my ancestors.
I love that. I love that you said you have allowed yourself, you've allowed your ancestors, you've allowed God, to use you as a vessel for the work that you're doing now. And I think healing is not so much about, doing, it's about
Yeah.
allowance, and even awakening, it's not so much about doing, it's also about allowance, allowing
Yeah.
yourself to be a channel of that, allowing yourself to let go, allowing yourself, to see the things and see them differently or in a way that will allow you to grow. So I think you said quite a few things. So I have two questions that I want to ask. If you say
Okay.
African situated or situation, what is that? You said that people have African situated problems, those are the things that people come to you. So what does that sound like? A person would come to you and say, Anele, I'm struggling with this. What are those things that are African situated?
Academically, and when we think of psychology, it has predominantly been under the construct of what we know what psychology is: the mind, the body, and just the mind, body, and soul. For me, the psychology I think of is the psychology of the mind, body, soul, spirit, and energy. So, in the dominant tradition of psychology, we end up on the soul. And again, the soul is philosophically constructed. I mean, if you ask philosophers what is a soul, they will they would derail you to all sorts of angles and all of that. If you ask theologians to take you to the place of soul as well. But in psychology, what lended me to African situatedness, there's been a lot of writing by African scholars, the Augustine Noyes, Lisiba Balois, you name them, Professor Nhlanhla Mkhize. One person who differed in his understanding of what is called African psychology is Professor Kopano Ratele. In his book that it speaks about what psychology looks like, you must check his work. In that book, he argues that African psychology is not homogeneous. So we can't imagine and hope that what is in Africa that we may conceive as African psychology is the same as in Nigeria. This is now where he spoke of locatedness. How do we think of psychology that is located in South Africa? There, then, I drew from that concept of African situated psychology because realities of Africanness, or what we can consider African in South Africa, again, it's very diversified. We've got 9 official languages that give us different ethnic groups and different perspectives. So how I may do closer understanding of what is the psychology of imbeleko, that is, when a child is born, they get introduced to ancestors. There's a particular traditional and a ritualistic perspective. However, in the psychological understanding, what is it that we are doing in the psyche of this child? Remember, the child is not aware. Us as adults, we are aware of this. So by virtue of doing that, we are awakening a deep unconscious sense of being in the world. And already that child, by doing that ritual, is then connected with the supernatural world, connected and situated within what we call it Xhosa.
Okay.
Obviously, there are other traditional rites of passage and many other things, but for me, situatedness starts as far as doing rituals and all of that. So now, the question you answer, you questioned me about, what are these problems that are African situated? A lot of my problems that I deal with, interestingly now in couples therapy, I have people who, young couples, middle class, high class, rich, wealthy, who are working on istembu, that is polygamy.
Okay.
One, I'm in Sandton. Again, it depends on the type of psychologist that people look for. On my website, they can see I've got an appreciation of culture and all of that. So already they have an understanding that this person is aware of certain cultural nuances of what determines his tame. That is polygamy, and already by the time people come to bring those issues, I'm aware that now I've got to bring in my ancestral traditional head as one who is familiar with that space, as well as the psychology part of it. So that is the situatedness I'm talking about in terms of couples work as an example. 2, I have a lot of patients who struggle with paternity issues, where one either could have been raised by a stepdad and then later discover their biological father. Now, there's a psychology that happens in there. You've been raised and socialized and cultured into a culture, into a surname, into a clan name that is not biologically yours. One of the interesting cases I'm working with at the moment is a young woman who has been raised by a stepfather, and all to discover that in reality, that's not her father. Now, she's conflicted. When lobola needs to be done, who is it going to be done to? Is it the stepdad's family? Or, so basically, the family that raised me, but it's not my bloodline? Or am I being loyal to my stepdad who has done so much for me? Or alternatively, I have to go and seek and look for my biological family. But what implication does it have for her? Because that what now, it then introduces a different kind of a relationship, a different kind of a conversation. Now it questions the integrity of her mother. It questions the integrity of the family. When the families need to be brought together, what are we going to say? And this has caused a significant distress for my client. That's the situation that I'm talking about. The depression comes as a result of one, I have been deprived my paternity for 27 years, and now I discover. Now, how do I tell this to my fiance, who is ready to pay lobola and he doesn't understand the dynamics? So now I have to disclose to my fiance. I have to have a conversation with my mother, who is depriving me of having that conversation. That's another two about identity and paternity. I have realities of people that say, I'm stuck. I've tried everything and anything in my life. Can you help me explore and tap into the unconscious or the subconscious that have to do with my ancestral calling? Or it could be the gift that I have. A lot of people that I have in my practice, young, educated, but most of them are presenting with what I can call symptoms of Ukutwasa or symptoms of being gifted, where they've tried everything medical and psychiatric possible. However, they feel stuck in the world. Then they come to me to say, help me untap again to the spirit and the energy. And sometimes, interestingly, by virtue someone comes in, I know certain provocations and meets, either my body is going to respond, or I'm going to burp, or my ears are going to make sound, then I know it's not just psychology now. I'm being prepared. And already my clients are accustomed into the world that I work. So instead of saying, Yvette, I'm seeing this, I would say I'm picking an energy that feels like you are exhausted. Tell me more. What about exhaustion? What is it that you are feeling now? I haven't tapped into the psychology, but already my body,
Tapped into the energy.
my senses are tapping into the energy. And it goes back to what you said, Yvette, that I actually accepted this now that probably I'm really gifted. It takes me seconds for people to get into my space and already be covered in that which is of spirit, the psychology and the soul. So it's a very spontaneous process, but I became more aware of it to say, okay, now I can differentiate when is Yvette needs pure psychoanalytic, your traditional psychology, and then I frame my mind into that. But then if the spirit then informs the process, my energy just changes and I make the client aware to say that now you must be aware I'm no longer the only Anele that I then come with, I call it my entourage. So please allow space for my entourage to participate in this healing space because now it's no longer mine, but it's in community with those who walk with me.
That sounds like a beautiful integration that you've made, of both worlds with psychology, the mind, the body and the soul, I suppose, per se, and then the energetical part, which speaks specifically for Africans, because you are based in Africa, you're in South Africa,
Yeah.
and some of the things that we experience are unique to us as Africans. And just like you said, a lot of people will go and see therapists, they'll see different types of healing practitioners and they'll still feel stuck. I know because I also have people in my life who have had to go through the Ukutwasa journey, and before they got to that point, it was so much of being misunderstood and not understanding it themselves, so much of not knowing where to go, so much of just, like what you said about you experiencing symptoms, like, and then you go to the doctors, then they'll say, we can't find anything, but we find these things. And then you're like, okay, what is going on with me? So what I like about what you've said is that you have, what I hear you saying is that, your offering is more than just, from the mind and body, it's that you're including the spiritual, and from specifically from an African perspective, which brings a unique healing, healing what's this healing way for the people that you work with, which I think is quite beautiful, to have that ability to tap into the energy. I know for me as well, I've never been, what's the word? Everything I know about African spiritual ways of healing is through just exposing myself to it, like through social media and learning and having people around me who are on the journey. So I haven't been exposed to it myself, but I do understand that we are energetical beings. We are not just a body. We're energetical. So nothing shocks me. If I get a dream about somebody, I know that that's just, the divine or angels or whatever divine entity sending a message to me, right? For me or maybe for someone around me. I know that if I happen to know somebody's news, I know that's a message. So those things don't shock me because I understand that, there's that quote that we're spiritual beings having a human experience. And sometimes we're so dissociated from that we don't understand some of the things that we experience, and that those things are spiritual more than they are physical, And part of that healing is understanding that and integrating that, with our journey as individuals. So there's something that you said, I think just about just about the healing journey, because you've sort of unpacked it. Someone would come to you and they'd say, what, I haven't known my dad, I've never met my dad, and I feel lost, I feel disconnected, right? So I'm wondering, what does integration on a personal level look like? So I would imagine that somebody, like you said, they'd have an identity issue. They'd feel very disconnected from their ancestors. They feel like the family that they're in, because here's what I see, right? When I work with somebody who has had a similar situation, right, whereby they find out that their dad is not actually their dad, and they've lived this reality that actually wasn't truth for the longest time. One, there's strong feelings of not belonging, like I don't belong for their entire life, even if they weren't, they may have not known the truth, but they've had this sense of not belonging for a very long time in their existence. There's a strong feeling of disconnect, feelings of not fitting in, and feelings of not being worthy. So how do they then, if someone comes in and says something like that, what would the healing journey for someone like that look like from both a psychological and African perspective?
I think I like what you said. Integration for me is understanding different parts of each perspective. So ideally, one is coming to see me as a psychologist, and I remain in that space. I remain ethical in what the profession requires of me. But the only difference is that I don't subscribe to that which I was trained that I am an anonymous body. Basically, what psychoanalysis or psychoanalytic theory has taught us that as a therapist, you remain anonymous. So you give the client or the patient the work, but you are absent from it. Whereas for me, I am the embodiment tool that facilitates not the techniques, but the healing process. So already I have that understanding, and I understand what the patient then comes with to say, I look for someone who's going to tap into the psychological. And again, the psychological means that I am the one who is the knower. I know I've been trained on how to diagnose, on how to read between the lines and all of that. However, for me, I do that with the client. I believe we are retelling a story in therapy. So I then co-construct a reality that looks and feels good for you in terms of what we're talking about. So I will then draw from you as to what do you imagine the kind of healing that you need. I don't prescribe it, but I then ask you from whatever that's presenting, yes, we're sitting with this situation. How do you feel and think that integration would look like for you where you are in the world? And then take it from there. But I also facilitate that process because, again, there is a situation or cases where there's really a clinical perspective or understanding about this. Let me make an example about what you meant earlier about struggling to find the diagnosis. It could have been depression from one doctor to the other, from one psychologist to the other, whereas there could be a cosmological disturbance in that depression. Now, a clinical psychologist will be able to tell a pure clinical presentation of depression. This is where the DSM comes in, the Diagnostic Statistical Manual that we use to diagnose all disorders. Again, it's going to tell you the duration, it's going to tell you the symptoms, how long it should have been, and all of that which you need to know about it. We apply it and see. Most of the time, the DSM will lead a patient to either medication or a psychiatric hospital. Fine, we can do that. Now, if it's Anele who has that clinical presentation, in addition to a cosmological calling he doesn't understand, that could look like a disorder, whereas it's not, because the spirit is not rested, it doesn't do what it has to do. Now, what we need to do there with Anele, who happens to have them, we then invite a spiritualist or a sangoma. It could be a medium or anyone who can tap into that world. And then we integrate these two worlds. You've been on medication, you've been admitted, like I have been, taken to a spiritualist, abatandas, the healers, prophets, and all of both these two worlds. They then say, okay, there's something that warrants attention here. I'll continue taking my antidepressants like I have over the past years, up until I realized I am just not, like I'm not responding. Then it meant I needed to move on this other side. A lot of my depression, as an example, Yvette, has been existential. Meaning, it has always been about seeking meaning and quality of life and questioning my purpose in the world. For as long as that purpose had not had a definition, I kept on being depressed. So for integration for me, it took appreciating that I have depression, that is clinical, and again, there are traumatic childhood experiences and everything else that I've had. Now, but the dominant story of my narrative over the past 3 years, 2018, 19, 20, 21, leading 21, I've had existential depression. So for me, integration was move towards the acceptance of your calling. The day I did that, my life felt integrated. To where am I now? Everything that I touch is moving because I am within and aligned that which was existential. Yeah, I can get depressed here and there, but it doesn't warrant me to go and sleep in hospital. It doesn't need me to take medication. So in that regard, integration for me meant appreciating two worlds and undergoing a journey of what the other world requested, as well as for what the other world requested. But the dominant narrative of my cosmological understanding, immediately there's a dis-ease or a disruption in the spirit, everything else falls apart. Then I know I need to see my therapist to align the mind. And then I know my spiritual mentor to align the spirit. But then I need me to participate with the cosmological synergy of what the mind, the body, and the spirit needs. Then my energy improves. When my energy is off, I know I'm not okay. And that's the integration I'm talking about.
You put it so well. I'm also just taking notes here so that I don't forget, because I also want to allow you the space to just finish what you're saying. But you've really just put it well. You know, one thing that I've heard you say is that we are in charge of our healing journey, you know, and even you do that, of course, as a person in the healing space, you know, as a professional in the healing space as well. I also hear you saying when the person walks in, you ask them, what does your healing journey looks like? And there's another powerful thing to add to that is that one of the things that I do when I work with the clients that sometimes I'll imagine them healed. And it's also powerful, you know, it's also just powerful for them to see themselves healed and to say, what, you know that question of what are you, why are you here? You know, what are the outcomes you want from the session? And to say, but what does that look like for you? What does healing look like? What does it sound like? You know, what do you want this journey to look like? And specifically for you, because someone might need a medium, you know, in their journey. They might need a psychologist and a medium. Someone might need to go Ukutwasa. Somebody might need a prophet. Somebody might just need to pray, in their own capacity and, sit down and kneel and have those conversations with God or their divine entity. So I think you've prayed it so well to say that what I hear you saying is that we are in charge of our healing journeys,
Definitely.
and I love that, you reflect that back and say, what does that look like for you so that it's an authentic healing journey, just as
Yeah.
what you've done for yourself. I also hear you saying that, acceptance, right? Acceptance is one of the key things in the healing journey. For example, accepting certain things like, okay, yes, I am depressed, yes, I have these feelings of this, or yes, this is what I'm going through right now, because you can't heal something that you have not accepted, you
Yeah.
can't heal something that you have not even acknowledged. So I hear a big part of it is also acceptance, and just also understanding that, I mean, there's different types of depressions, different types of things that may lead to that. And part of that is, of course, childhood trauma. A part of that is, trying to find meaning, feeling like, you don't have a purpose in this world. And part of that, I think, specifically for us as Africans, is that disconnect from who we truly are.
Yeah.
Like, I think specifically for you, this is just me, and I guess the sense that I would get specifically for you, because your work is in, this meaningful space of healing,
Yeah.
and it's in, helping others find meaning through. So it's like, if you're the person that needs to help others find meaning, of course you would deeply seek meaning for yourself on a deeper level. Of course you'd have that why am I here thing, because if you can answer it for yourself, you can then, give that to others as well, or at least provide space for others to find it for
Definitely.
themselves. So for me, like, as you were talking, I'm like, oh, that makes sense. Like, you were called to be in the space of meaning and how to help others find meaning, in their own way, but you had to find that within yourself first. And that's like the beautiful connection that I'm also noticing. So those are some beautiful things that you've said, and I like that you've unpacked the journey really thoroughly. Now, just to make it a little bit more personal, what has healing for you looked like?
Wow. As you're reflecting on my response, sometimes my responses are not planned. But the way you've unpacked it, I'm able to hear myself through your own interpretation of what I was trying to make meaning of. First, before I can go there, I'm realizing now, because I always ask myself, what makes people come back to therapy? You might have worked like us. Um, the ego would say, definitely you're a great psychologist or you're a great healer. But I understand that many people, and again, they've been to therapy, they're psychologized, they're quite well, but they are looking specifically for a space to make meaning. And you can't buy meaning. And I suppose there are certain people we can go for to access that. And I think even in my way of working, it always leads to helping people find that melancholic space, like that you depleted, you empty, you don't feel anything. But I suppose the reason why people come back, we are constantly trying to make that meaning. For as long as we're still floating, we are not connected to what which is divine, to what which it brings us to spaces where we feel we're stuck. We won't come for therapy, but that is what which makes us come for therapy, because it helps us to really connect with the disconnected parts of our being, and this is where we make meaning. So for me, I consider my healing journey as evolving
Mm,
with time and experience. The kind of healing that I needed from 2017 to 2019 was very medical. I needed to heal my body because I had depression, I had ADD, I all of this because of a neurological condition I had. As a result, when I was 7 years old, I was hit by a car, and it really messed up my brain structures and brain functioning. So my focus at the time, 2017, was dealing with this ADD, dealing with this epilepsy, dealing with this depression. However, when that part got somehow reconciled, then I moved to the healing of the soul and the spirit. That has been an ongoing journey. To where we are right now, I'm still in that journey because it never it's never complete. You never say I've ticked the box. I mean, you spoke about childhood traumas. I have my own childhood traumas that have shaped me even now, Yvette, where you've got this growing popularity around you and it feels so uncomfortable because you have always had a relationship that's very hard with yourself, that I was so invisible in myself because I never saw myself amounting to anything that will be out there because I was a short child, chubby, and all of those insecurities. So even now, it takes me a lot of time to get credit and all of these things because before it was Anele doing the work and I was not in there. Whereas now, Anil is in the work and is in sync with that. But now, praises and everything is what makes me uncomfortable. So, my healing at the moment is it's still ongoing. I mean, last week I went for therapy on Monday, and it felt like a very strange experience because there I realized these parts of myself that have drained me to feel so empty. I felt so empty. It felt like I didn't have this part of my body. The way it was so empty, and I realized that part of my work has been about giving and outpouring. And I realized that in that moment that part of the healing I need to do now comes from within. I need to do a lot of internal work that I won't need an external factor to do that, but I need to create a healthy relationship with myself to understand that now we are here. And because you are here, enjoy the moment, simmer in it, immerse yourself in it, but don't deprive yourself of saying, I have actually done a great job to allow myself to participate with God, the universe, and the cosmology of those who I walk with.
This conversation ended abruptly due to technical challenges. This was recorded over a year ago. There is a part 2 which I have to try and find and I will post. So thank you for listening to this conversation. I hope it was insightful and I hope it helped you on your healing journey. Please do follow Anele Siswana on all social media platforms. You can consult with him. I'll post all his details in the comments. Thank you for watching and remember to subscribe.